Hello, dear friends. Coming to the last lecture in the 4 lecture series on DMIMS Suggestion for AETCOM. This is based on the findings in a study, Critical Appraisal of Bioethical Inclusions in AETCOM module for competency-based undergraduate medical education as prescribed by Medical Council of India, published in Forensic Medicine and Toxicology Journal of India by Dr. Gaurav Mishra et al. This last lecture will cover the impact of life sciences on genetic constitution and future generations with regard to medical profession. According to Oxford Dictionary, life sciences are the sciences concerned with the study of living organisms, including biology, botany, zoology, microbiology, physiology, biochemistry, and related subjects. Life sciences can have a significant impact on the genetic constitution and future generations of living beings, especially humans, by influencing their health, evolution, and adaptation to changing environment. One of the most significant impact of life sciences has been the development of genetic testing. Genetic testing allows doctors to identify and diagnose genetic disorders, which can help them to provide early intervention and treatment. This has led to a significant improvement in the quality of life for many people with genetic disorders. In addition, the life sciences also have led to the development of gene therapy. Gene therapy is a medical procedure that involves the modification of a person's genes in order to treat or prevent a disease. Gene therapy is still in its early stages, but it has a potential to revolutionize the treatment of many genetic diseases. The life sciences have also had a significant impact on the way that we think about health and disease. In the past, we thought of health as simply the absence of disease. However, the life sciences have taught us that health is much more than that. Health is a state of well-being that encompasses physical, mental, and social well-being. The life sciences have helped us to understand the role that genetics play in health and disease. They have led to the development of new treatment and intervention that can help improve people's health. The impact of life sciences on genetic constitution of future generation is profound. By understanding that the genes that contribute to disease, we can develop new ways to prevent and treat. This will lead to a healthier and more productive population for the future generations. Some aspect of life sciences that affect are mutation. The production of heritable changes in DNA can alter genetic composition of population over time. Mutation can be caused by natural and artificial factors such as environmental mutation, genetic engineering, or gene therapy. Mutation can have a positive, negative, or a neutral effect on the fitness and survival of organisms. For example, some mutation can confer resistance to diseases and enhance certain traits, while others can cause genetic disorders and increase susceptibility to infection. Selection. The process by which certain traits or alleles become more or less common in population due to their effect on reproductive success. Selection can be natural or artificial depending on whether it is driven by environmental pressure or human intervention. Selection can shape the genetic diversity and adaptation of population to different conditions. For example, some traits or alleles can increase the chance of survival and reproduction in certain environments, while others can reduce them. Migration. The movement of individual or genes between populations that can affect their genetic structure and diversity. Migration can be the cause by natural or artificial factors such as dispersal, colonization, migration barriers, and gene flow. Migration can introduce new genetic variant or allele into a population and remove them from it. For example, some population gain or lose genetic diversity due to migration and event. Ethics, the moral principle or values that guide the conduct and decision of life scientists and society regarding the use and application of life sciences. Ethics involves issues such as human dignity, right or responsibility, justice, beneficence, autonomy, consent, privacy, confidentiality, safety, risk-benefit analysis, social and environmental impact, etc. Ethics can influence the goal, method, outcomes, and implication of life sciences research and practices. For example, the ethical questions that life sciences can raise are: how should we treat living organisms? What are the limits and boundaries of human intervention in nature? And how should we balance the benefit and harm of life sciences for individual and society? Gene editing technologies such as CRISPR raise ethical and bioethical issues, some of which include safety concerns, access to gene editing technology, potential for unintended consequences, potential for eugenics, and potential for genetic discrimination. The medical profession plays an important role in the impact of life sciences on the genetic constitution of future generations. With the advent of gene editing technologies such as CRISPR, scientists are able to approach diseases in a new way. However, this change is being driven by innovation that raise ethical and bioethical issues. Genetic counselors and clinical geneticists are professionals who play a key role in helping individuals and families understand the risk associated with genetic conditions and make informed decisions about the healthcare. The rise of technology in medical sciences is a complex and challenging issue. However, by working together, bioethicists, healthcare professionals, and public can ensure that these technologies are used to improve the living lives of all. The rise of technology in medical sciences is a double-edged sword. On the one hand, it has the potential to improve the lives of millions of people. On the other hand, it also raises a number of ethical concerns. It is important to have a public discussion about the ethical issues raised by the rise of technology in medical sciences. This discussion should involve bioethicists, health professionals, and the general public. It is also important to develop guidelines for the ethical use of new technologies. These guidelines should be based on ethical principles such as respect for autonomy, beneficence, and justice. By working together, we can ensure that the rise of technology in medical sciences is used to improve the life of all people. So with this, we conclude the 4 lecture series. Thank you for patient listening. Have a good day.